I'm Dr. Daniel Robison, and my practice is Advanced GYN Solutions. I specialize in not only gynecology, but urogynecology. My practice is named Advanced GYN Solutions because we truly use cutting-edge technology and new techniques to treat complex issues and find solutions for women. The specialty of obstetrics and gynecology is a solid foundation upon which knowledge is built, but then female pelvic medicine reconstruction surgery is more of an expertise. I do a lot more of the complex surgeries that most gynecologists just simply aren't trained in. I chose obstetrics and gynecology because I had an attending, Dr. Little, who persuaded me that I could do both surgery and medicine in that specialty. I was going to be a general surgeon, is what I thought I wanted to be. And he said, he took me and introduced me to a lady and said, we were getting ready to do a hysterectomy on. And he said, "This is Miss Smith, and I've taken care of her for 30 years. I take care of her 2 daughters, and I've delivered all of her grandbabies." That's a relationship. You don't get that if you just take out somebody's appendix. It's really important to me that the patient feels comfortable and secure. It's important to me that I am able to communicate exactly what's going on. And then I really like to list out all the options that are available to treatment and go through those options, because generally a conversation with a patient will tell you which is going to be the best option for her. Not every patient needs surgery. Not every patient is a good surgical candidate, but some truly will benefit from surgical procedures. The advancements that have been made in urogynecology and gynecology have been, since I trained in the late 90s, we've gone to where we did primarily things through large abdominal incisions, to where we moved into laparoscopic procedures as the dominant form, and now into robotic. It's gotten more precise, less invasive, and more successful with better outcomes. We got the Da Vinci robotic system here in Wilmington in 2008. And I was one of the initial people who was trained to use it and have been using it consistently since. For a number of years, I was one of the Da Vinci robotic proctors and went all over Eastern North Carolina and taught other physicians how to use the robot and advanced robotic technique. We do minimally invasive hysterectomies as an outpatient now. We're able to do severe endometriosis. We can do extremely large fibroid uteruses, which historically would have required a very large abdominal incision. We do a lot of pelvic reconstructive procedures with the robot that normally would have required long hospitalizations and large incisions, and now can be done as either an outpatient or a 24-hour stay. It has been truly revolutionary in making the procedures minimally invasive with less pain and a quicker return to normal activities. My mom had a hysterectomy. She had a large vertical incision, was hospitalized for 3 days, and kept on her back for 2 weeks. We can now do the same hysterectomy through tiny little incisions as an outpatient and have the patient walking in their neighborhood the next morning, driving within a week, and returning to full activities in a matter of days. We use the robot a great deal for pelvic prolapse and pelvic reconstruction. When people have prolapse after having children or having vigorous lifestyles, their bladders can fall, their uteruses can fall, they can get a hernia between the rectum and the vagina. This all can be effectively and minimally invasive in a minimally invasive technique treated with a surgical robot. When you talk about robotic surgeons, you really should ask the number of cases that they performed. There is a learning curve. They say that about the first 75 cases you need to do before you truly master the technique. I'm right about 1,000, so I'm pretty comfortable in my skills. Incontinence is a common condition in women who, especially who have had children. Greater than 50% of women who've had children will have incontinence before they reach the age of menopause, and it can be an urgency issue, an overactive bladder issue, or what we call stress incontinence when they lose urine with exercise or with bending, stooping, laughing, coughing, sneezing. Stress incontinence is usually treated through mechanical means, and that may be physical therapy. It may be placement of a vaginal pessary. It can be an in-office procedure called urethral bulking, which can be done in 10 minutes comfortably in the office. Or it may mean that we need to take you to the outpatient surgery center or the hospital and do a larger, more formal procedure. For the treatment of urge incontinence, we start in the least invasive possible way. We do behavioral management, we do dietary avoidance. Sometimes we'll actually do dietary testing to determine what foods or irritants to the patient. We also will treat these patients with medications, some of the newer medications which are safer than the older ones. We also will offer posterior tibial nerve stimulation, which is a completely safe procedure for the treatment of urge incontinence, which can improve your symptoms up to 77%. We do cystoscopic injections of Botox into the bladder, which can be remarkably successful in the treatment of urge incontinence. And in some cases who have severe urge incontinence or urinary intention, we also offer the InterStim neurostimulator. We pride ourselves at Advanced GYN Solutions for covering the gamut of gynecology. I have a nurse practitioner who does annual exams and birth control and general gynecology, where I try to focus my time on more complex issues, whether it's pelvic prolapse, urinary incontinence, large fibroid uteruses, severe endometriosis, or other complex gynecologic issues. The advantage of a small practice is you're not going to be a number. Everyone's going to know your name. You can call and your phone call will be returned. And it's a much more intimate feel than a large practice where people are just rotating in and out. My practice, Advanced GYN Solutions, we are a subspecialty of gynecology. We do receive a lot of our patients are referred by other gynecologists or other medical professionals. We do have a lot of patients who do their own research and find us on their own and simply call and make an appointment.